So we're pretty excited, aren't we, about our publication titled Safe and Effective Use of Methadone in Hospice and Palliative Care Expert Consensus White Paper.
The challenge with this is, and part of what kind of brought it to be, is that there was not good guidance here before. So I think when you get a bunch of experts around in an area that has some data behind it, and there are a lot of areas that don't have strong evidence base behind it, I think that was the purpose of this paper, to say what ought a clinician do and what's safe to do when there's not a lot of evidence in that space of decision making for a high-risk drug.
I think one of the most important things is recognizing that methadone is a highly valuable opioid in our armamentarium in treating pain. But methadone requires special attention to dosing and to monitoring how the patient responds and to adjusting therapy. And certainly there are guidelines published by many organizations, notably the American Pain Society, that speak to the safe and effective use of methadone, but they couched it more in terms of treating chronic non-cancer pain patients, where what our goal was to apply this to the patients who have a serious illness, or in fact may be very close to the end of the road. And how can we help practitioners gain some consistency in dosing and even selecting candidates, who is an appropriate or an inappropriate candidate for methadone. So we had representation from medicine, nursing, pharmacy at the table, and it was quite a consensus building process.
The APS guidelines that came in 2014 were done very much on a population-based level, looking at patients that did not have serious illness. And I think the challenge in applying it to our population was that the risk-benefit profile changes significantly when goals of care change.
A lot of practitioners are fearful of methadone, and it was our goal to provide them some guidance on how to do this consistently and get that good pain control as quickly as possible while still maximizing the safety aspect.
In my mind, we've been getting the word out about this paper, knowing that it was coming, and kind of vetting the findings from this paper with different audiences. So I'm looking forward to really helping spread the word more widely, like from presentations and this. But I also hope that this serves as a little bit of a platform to use this method for the two of us to really answer some other questions which we are wrestling with, and develop a little bit of expert consensus around medication use where there's not a lot of evidence behind it.
I think some next steps after publishing this paper, at least in my mind, one thing I'm very interested in is educational research. So I have designed a short online course for prescribers and other practitioners to learn how to operationalize the things that we talk about in this paper. So I'm very interested in educational research, and I think getting the word out there so that we can have a consistent approach to dosing and monitoring methadone is a good next step.